very important for us to support research, because that was one of the reasons that we sort of got together to support patients in as many ways as we can, and research is fundamental to that for the patients, because there is so little known about MPN still. We've come forward in leaps and bounds over the last few years, but so much still needs to be found out. So research is one of the things that we really do want to push for the MPN community, because we do want to find a cure one day. There is no cure at the moment, and we also want to find out why we get them. So that is vital for MPN Voice. And to be able to do that, we do need people to donate and to fundraise for us. So our fundraising initiatives, anything really that people can do to raise money for us and have fun at the same time, because we do want to have that element of fun. We don't want them to have it as a chore to fundraise for us. We work in conjunction with Guy's and St Thomas's. We're part of the charity, the Guy's and St Thomas's charity, and that is an amazing support system for us as a very small organisation. They support us in lots of wonderful ways, especially in getting us places in massive big events like the London Marathon. We wouldn't be able to get an inroad into those sorts of events like that, but Guy's and St Thomas's charity can, and they supply places to our people to take part. So we get that support network from them, and to be able to join into all the events that they organise. They organise like an abseil, 10k runs, and their team of fundraising girls look after our fundraisers as well as us. So that's a massive support to us. And we just ask people to think of any ways that they can fundraise. So it's not just about abseiling down a tall building or running a marathon or 6 marathons in 6 days, as one of our fundraisers did in the Marathon des Sables last year. It's small events as well, like a quiz night or a bingo night or a tea for 2. Go out with your friend for afternoon tea somewhere nice and donate the equivalent amount of money to MPN Voice. That's something that can be done really simply. You're having fun and you're also supporting MPN Voice. A lot of people now are getting wedding favours. So we are supplying our charity wristbands or our pens, and they're giving those out to their wedding guests as wedding favours, because they're paying for those, they're buying those from us, but it's also a way of getting our name out to people, and it's raising awareness, because that is a big part of fundraising as well, is raising awareness about MPNs and MPN Voice. So that really does help. And also another big thing now is that people are having donations instead of birthday presents or anniversary presents. So there are lots of ways that people can do that. So we just encourage people to do whatever they can, whenever they can. And you know, that's fantastic for us. Massively important for the whole MPN community, not just for the patients and not just for their families and friends and carers, but for the healthcare professionals as well. It's a way of bringing us all together in a more relaxed and informal atmosphere than the consultancy room, and it gives us a chance to show the patients what is going on in the world of MPNs in terms of research, new medications, that kind of thing, so that they're getting the information straight from the horse's mouth, you know, with all the experts we get from around the world. And we are very lucky that we get the really top good, you know, consultants coming over to give the talks, and we're supported by lots of haematology nurses. So these Living with MPNs days are so vital in bringing that whole group of people together to be able to learn and share and grow and empower the patients, because that's what, you know, we try at MPN Voice to do, is to empower patients to take more control of their MPN and of not being afraid to ask questions. So this gives them a chance to see the consultants in a slightly different light, as it were, than in the consultancy room, And it shows that they are more human and that they can be approached. They are open to questions. And so it's a way, as I say, of empowering the patients, of showing the consultants what the patients want to know, what support they need, and also for the family and friends to show them that they are supported as well in this MPN journey, because it has a big impact on them as well. So it's bringing the whole thing together and just, you know, showing that it's all there, the support, the information, the care, etc. I would like to see a lot more support in smaller regional areas for MPN patients, especially the small towns or little villages, and in remote areas, say up in, you know, far north of Scotland or the islands, or, you know, sort of in mid-country, where there are smaller groups of MPN patients and there is the access to information and support groups is not there. So I would love to see that patients, wherever they live, could find a support group or a support nurse that they can go to for information, and to have information leaflets, not necessarily ours, but hopefully ours, but more information on MPNs to be more readily available to everybody. And also, like everybody, having ET myself, I would like there to be a cure one day. I would like, you know, somebody out there to find a way of hopefully curing these.